Hi, Floppycatters. We're back with Dr. Dragos. Thank you for being here. Dr. Dragos is here today to talk about feline idiopathic cystitis, which is a request I got from a reader when one of my newsletters I sent out. I said, "What else do you guys want to talk about with a holistic veterinarian so we can learn to restore health and not always rely on drugs?" So, thank you for being here to discuss it.
Thank you, Jenny. Thanks for the invite again. I love talking about pets, especially kitties.
Yes. Well, I'm glad that you do because I've learned a lot. And this one I'm going to learn a lot too because thankfully I've not experienced this with a cat. So, my first question to you is, do you think anything is really idiopathic?
Holistically, no. So
Okay.
conventionally, yes. Conventionally, when they can't figure out what the heck is going on, they call it idiopathic. But holistically, and especially with Chinese medicine, they look at things differently. So there's a whole different paradigm. We're not looking at a specific disease, we're looking at a pattern diagnosis. And so holistically, we have figured out what's going on because we're not focusing on little things like bacteria and viruses and metabolic pathways to answer our questions. We're looking at the big picture. We're looking at the forest and not the trees.
Got it. Okay. My mom's cat, one of her cats, died of an idiopathic lung infection, and I'm like, how? What? But yes, okay, that
Yeah,
makes
that's
more
weird.
sense.
Yeah.
Yes.
Yeah,
Okay.
they just didn't know what caused it,
Yes.
which was
Okay.
probably fungal.
That would make
Is
so
that
much more
that
sense.
gets missed a lot.
Yes. Okay. Huh. Yes. That would, yes. Okay. So before we started, I was like, I don't want to waste people's time with that right now, but I'm like, it's like going ding, ding, ding in my head.
Going on a tangent there.
Yes. Before we started recording, I asked, what should I call this? Feline idiopathic cystitis. And you said, well, there's several names for it. So can you mention what those are, please?
So there's feline interstitial cystitis, which is kind of like the name that they got from the human, um, like women with pelvic inflammatory disease. It's an interstitial cystitis. And then we've just got the feline lower urinary tract disease or the idiopathic feline lower urinary tract disease, because it used to be called the fluta back in the day. And then one that I hadn't heard of before is Pandora syndrome. And I absolutely love that name
Yeah. Yes.
because that's what it is. It is just the Pandora box.
Pandora's
You reach in
box.
there and you're like, I don't know what's going to come out.
Yes. Um, okay. So what is it? What no matter what name it is, what is it?
So, feline interstitial or idiopathic cystitis is inflammation of the bladder. And the symptoms we see are peeing a lot, peeing outside the litter box, peeing in weird places, painful urination, bloody urine, straining, um, and just general discomfort, focusing on the bladder. And there is no bacteria involved. This is not a bladder infection, but we have to rule out a bladder infection because basically, this issue with the bladder is a diagnosis by excluding all the other things. So we have to do the urinalysis, make sure it's not a bladder infection. We have to do the x rays, make sure there's not stones. We do ultrasound and make sure there's not a mass in there. So we look at all these other things. We culture the urine. Sometimes we'll get a urinalysis that's kind of blah, but we'll culture it and then bacteria will grow. So sometimes you have to dig deep with these guys, but it's a inflammation of the bladder that's not from an infection, for example.
Okay. Okay. One of the things that I wanted to clarify is when a cat pees outside of the litter box, it can be medical or it can be behavioral. And my experience is that if they're peeing close to windows or doors where an outside cat could be peeing, the chances are it could be more behavioral.
Correct.
Okay. So that's one thing that I recently learned that I think it's important to share. If someone's like, "Oh, well, my cat's peeing outside the litter box," but pay attention to where they're peeing outside of it.
Mhm. Yeah, but honestly, you still need to do a urinalysis because they can have a low-grade bacterial infection that makes them more prone to having that behavior.
Ah,
So it
okay.
still warrants looking.
Yes, yes, of course, because especially with a male cat, there's no reason to risk that.
And with
Uh,
male cats especially, I just want to make this clear that if they're straining to urinate and not producing urine, that's an emergency. That's a blocked cat. So we don't want to ignore that because that's an issue. It can happen with the females, but the boys, it's primarily the boys with the narrow urethra that get blocked. So if they're straining and not peeing, it's an emergency. You need to go to your vet.
yes, that's what I was alluding to. So thank you for making that more clear. I've also never experienced that with I've always had male cats and I've never experienced that, knock wood, but yes, I would be terrified. Be
Yeah.
straight to the ER.
Yep.
So what causes this inflammation in the
Well,
bladder?
that's the big question. That's why it's idiopathic. It's like, what is it? So conventionally, they have clued in on diet, although um they have a different way of addressing that. But it's also um the bladder wall is changed. So there's a defect in the bladder wall, which then exposes the nerves of the bladder more, and you get a really sensitized bladder to pain.
Okay.
So it's physical. So this is conventionally. So it's physical with the bladder. It's diet related. It's stress related, and it's also the HPA axis, the hypothalamic pituitary adrenal axis. So basically, adrenal fatigue or adrenal exhaustion from stress. So stress and diet are your biggies, which then cause the bladder wall to be funky and your adrenal glands to be just worn out. The poor kitty's adrenal glands are just fried, and their nerves are exposed in the bladder, making them more sensitive.
Okay. Wow. Okay. And then
Yeah, it's bizarre.
that's conventionally.
Yes. And holistically, it still is diet and stress,
Hmm.
but
Okay.
we address it totally differently.
Yes. Yeah.
So, you know, conventionally they do the calm and the urinary diets. So they add fish oil and call it a prescription diet, or they add tryptophan and call it a calming diet. They just add stuff to the kibble and call it prescription. Um, and Conventionally, they've caught on to the stress component. So they're actually recommending things like Feliway, which is the pheromone, the pheromone spray that's a chemical analog. And they're even recommending acupuncture, which is really interesting because a lot of kitties won't tolerate acupuncture.
Yes.
But the ones that do, that can be very helpful. And With stress, conventionally, they're using like Prozac and Clomicalm and amitriptyline. They're using their antidepressants and those kind of drugs. So they're using drugs for the stress.
Yes.
Which holistically, I feel like, holistic vets know that that's counterproductive because it just is a band-aid and then it changes things in the body adversely. Because,
Yes.
with this issue, which is really interesting, the gut microbiome is important still because when you destroy that, there's that gut brain axis. So
Yes.
you have some some emotional behavioral problems when your gut's out of whack. But Dr. Margot Roman is a holistic vet that's actually studying the urinary microbiome. And they've done this in human medicine too. It's really interesting, where you have actually a normal microbiome in the bladder and urethra. So if you're destroying it, you're destroying that lining of the bladder and then making those nerves more exposed and then increasing the pain. So really interesting stuff going on in that area. And one of the things that pet owners do by mistake is the cat will have a flare, because some cats just flare, off and on. Some have persistent problems. Some just have a problem every now and then and it goes away on its own. So it can be all kinds of different variations. But a lot of pet parents will see their cat straining and call the vet and say, I need an antibiotic because my cat's got a bladder infection. And some vets will be like, okay, here's some Clavamox, and not do the urinalysis and not look. And that does happen. And the cat will get better because antibiotics are energetically cooling. So you're cooling off that inflammation in the bladder, and it looks like it helped, and it looks like it was a bladder infection because it helped, but really it was just inflammation, and the antibiotics were just a cooling component where you could have used a cooling herb and had the same result.
And so not had the destruction of the gut microbiome.
Yeah, and then you're trashing the microbiome of the gut, the skin, even the bladder. So we're finding that that's a thing.
Yeah, that's awesome.
Yeah.
Go Margo Roman. Great. So what are the best ways to manage it other than things that you've already mentioned? Are there additional...
Oh, pain. You have to manage the pain component because that's a big thing. So pain would be, so conventionally they're using buprenorphine and torbutrol. And they're also using muscle relaxers. So things like Valium to relax the muscles. There's all kinds of drugs that they're trying, and we're going to go over the holistic thing because, you can throw all these drugs at them and treat the symptom, but you're not treating the problem. So, you can throw the pain relievers and the antidepressants and put them on a diet with some calming nutraceutical in it and think that you're taking care of the problem. But really, it's there. You have to look at everything. So you have to look at one of the big things besides diet and inflammation that you have to deal with and the pain is environment. So, because that's a big thing for cats. They're really sensitive about their environment.
Yes.
The litter box, what it looks like, if it's covered or not, what the litter is, how shallow it is, where the litter box is, how many there are. Like, they care about this. So cats are very sensitive to, they're kind of OCD. They like certain things and they don't like to change. And so if you have changes in your household, if your boyfriend moves in, that's a huge issue for a cat.
Yes.
And so these kind of things will trigger a problem. And so a lot of times we have to, when a cat starts doing this, we have to kind of look back and say, okay, what changed in that cat's environment? Did I get a new cat? Did I go on vacation? What frickin' stressed this guy out? And it's not like they're pissed off or mad at you. It's because it actually started this cycle of inflammation and pain. So the stress affected their nervous system and their adrenal glands and their microbiome. And the stress actually caused a physical problem with the bladder. And now they have inflammation and pain, and they're trying to tell you that there's something wrong. So environmental stuff is huge, and that's why they use like Feline and stuff. But we can be, a little bit, we can do more things holistically, for our environment. And just, if you've got a bored cat, give them stuff to do, play with them. Like, you just have to figure things out and kind of be a sleuth. If there's cats bugging them outside, we have to cover the windows, or it's like, that's kind of your typical cat stuff. Is the environmental enrichment is going to be important.
Yes.
And like, I have cats and people that are like, I am at my wit's end with this. I'm going to euthanize this cat. And I'm like, oh my God, stop. Just send them outside and let them have fun. Let them look at birds, let them chase lizards, whatever they need to do, and it'll go away, because your cat is just crazy in the house right now.
Yes. I say that cautionarily because you don't know where they're living or what's outside. So
yes. But then if they're going to euthanize the cat, what's the...
True.
And I'm like, this poor kitty.
Yes.
So I mean, you do a catio. Get the cat in a different situation that they may enjoy.
Yes.
And certainly you could do it without like letting them out into the wide world of dangerousness. But you can do it by, doing the catio thing. So you have to make some changes to the environment, and that's hard for people sometimes.
100%. Yes. Is there a chance that it also could come from the food? I was speaking to someone about this. I did the Nutra scan on Charlie, and it showed that he has a food sensitivity to salmon. But yet I was giving him salmon oil and had, no reaction, no problem. I was like, well, that can't be right. And I was told that they can still have low-grade inflammation from a sensitivity that you might not see, but it could show up somewhere else. So
absolutely.
If you have a patient like this, do you suggest a food sensitivity test?
That's not one of the first things I suggest, but that is something.
Okay.
So the first things I do is work with environment, work with diet. So diet, we want to do a fresh food diet, whether it's cooked or raw, because the kibble and can just drive that inflammation. So
yes.
Adding tryptophan to a kibble food is counterproductive, because the kibble is just causing inflammation. So you're not helping things.
Yeah.
So the type of food I feel is the most important. And then if we're doing all these things and we're not getting results, then yes, then your food sensitivity tests are something we can do, but it's not my first line.
Okay. What is your first line? You've mentioned some of them here, but can you go like one by one, what you would do or suggest to a patient?
Yeah, we need to make sure they're on a fresh food diet, because that's the foundation of health. And then we need to look at the environment. So anything that stresses the cat, we need to figure that out. And it's hard. I mean, because you move the furniture and they flip out. So you have to figure out your cat, and it's all very individual.
Yes.
And so, the big thing is litter boxes, like the type of litter and the type of box and where it is. We have to work with that and figure out what the cat likes. So diet and environment. And then, then you can start adding supplements. So that would be the next thing. And there are general supplements. So, if we want to help with the pain, something like homeopathic Arnica montana, or the PEA, they have a kitty PEA for pain, or CBD. So that can help with the pain component, which is a big problem. And then like nutritional supplements like probiotics. So if we do have this microbiome imbalance, probiotics are a nice and easy addition to a healthy diet.
Yes.
Like things like fish oil or salmon oil, because that's anti-inflammatory.
Yes. Okay.
And then we deal with more of rebalancing their worry and stress. So like the tryptophan is fine, but doing that alone is not going to solve the problem. You have to do all these other things. So
Yes.
but tryptophan, like in something like the RX vitamins Nutricalm, can be helpful. Essential oils like the chamomile and kitty boost can be helpful. They even have a juniper berry essential oil, which can help with urinary tract inflammation, and you just diffuse it in the environment. So juniper berry can help. So
Oh,
that's a cool one.
yes.
And you know how we use cranberries for like UTIs?
Yes.
You can use cranberries and they contain the D-mannose, which coats that bladder
Oh,
and helps the bladder wall heal. So cranberries and D-mannose are nice too, and there's some nice kitty products out there. You think about that just for bladder infections, but it's also for inflammation, which is what we're dealing with here.
yes. Yes. I'm glad that you mentioned CBD too, because I wondered about that.
Oh, absolutely. Because it helps with emotional stuff too. So anxiety. So you use like
Yes.
one of the calming CBDs. Yeah.
Yes. Do you
And
have a CBD brand that you like? Because they're like a dime a dozen, and I know that there's
yeah,
different qualities.
I like the CBD for cats. It's called CBD for dogs, and they have a CBD for cats. It's
Angela?
Angela's, Angela's brand. I really like that one. Um, I also like Dr. Rob Silver's CBD, and he also has really nice mushroom supplements for these guys. He's got a relatively new kitty one, a powder for kitties
Oh,
with mushrooms and nutraceuticals in there, which is nice.
hmm.
So that's a nice one for these kitties. And then there's the mushroom relax, which is also a treat for a kitty with calming mushrooms and calming herbs in it. So those are nice too.
Okay. You mentioned litter boxes. What would be your ideal litter box setup and litter choice?
So you want to have more litter boxes than you have cats. And they have to be big enough and low enough to be easily gotten in. We can't make it hard for them because they'll complain. And like I don't do the covered thing because that'll scare a lot of cats. So an open litter box that's low and large, and then your clumping litter.
Unscented.
Yes. Yeah, we want to avoid fragrances and all that, and even avoid cleaning with harsh chemicals like bleach and ammonia, because then your cat will not want to go in the litter box because it smells chemically. So
Yes.
you have to just do like a gentle soap and water kind of thing to clean the litter boxes and not make the litter box icky for them.
Yes.
So it has to be clean, but not too clean,
Right.
not chemical clean.
Right. Yes. Yes. I actually soak mine in warm water with like a couple splashes of vinegar, and
Yeah.
then I rinse it out.
Yeah.
Yeah.
Yeah. So
Okay. Something else that I've been thinking about lately, because I thought, like I live by myself. Probably shouldn't say that on the internet. Oh well, just did. Um, but if I had like my niece or someone like that come to visit who uses dry shampoo and all of these products, I'd literally have to ask her to go outside to use them because they would affect Charlie so much. And Charlie doesn't have this, but he's got other problems that those kind of products would create. And so I don't know if people in general think about that, like, oh, well, but I'm spraying it on my hair. But no, it's falling all down onto the ground where your cat is walking, or they're inhaling it.
right.
So
right?
all of those things can affect your cat's health, and I don't think a lot of people think about those extra things that they use in their house every day.
Because those are toxins, and toxins affect the body. They accumulate in the body. They affect the liver. They destroy the microbiome, and so they're causing more inflammation in the body, and which can be anywhere. And if your cat has a sensitivity in the bladder area, it's definitely going to affect that more. So it compounds the problem.
Yes, yes. And yeah, synergistically, then the adrenals, if they're shot, and then, or if the liver's shot, then that can really be a problem.
Yeah.
So, okay. And you mentioned acupuncture. What about, well, let's back up, because these to me are possibilities to get to the point of what the ultimate goal is, which I would think is remission, or, this isn't a problem anymore. Because
Right.
I'm under this silly understanding that the body can heal if given the right tools and taken out of the toxic environment or toxic stress, whatever. And that's just from my personal experience with Charlie, but also watching.
Well, that's the holistic thought, that we can heal even the chronic diseases that conventionally can't be healed, that can only be managed. We can rebalance the body and cure it.
Yes.
Okay. So it's possible.
So I sorry to keep it bringing it back to Charlie, but if he had this problem, then I would have also wanted to tackle it with red light therapy, because I think that would reduce the inflammation.
Absolutely. Okay. So you can actually do, on the abdomen, red light therapy on the abdomen, laser therapy on the abdomen. So anything that's going to be anti-inflammatory and pain relieving.
Okay.
Or even antimicrobial. I mean, those kind of therapies can be antimicrobial.
Okay.
Yeah.
But it is your understanding that it is possible for a cat not to live their entire life with this problem.
Yes, absolutely.
Okay. It's just a matter of identifying what the cause is. Like this is not something they're born with.
They have not found a genetic component. Like there's no breeds, like cat breeds, that are more predisposed. They find that boys are a little bit more predisposed than girls, but I think that's anatomically with their, the narrower urethra. But they really haven't found a genetic component. So it's not like they're born with that. And stress, they have found that they're like these cats' adrenal glands are smaller because they're just exhausted. And these are not things you're born with. These are things that occur over time.
Yes. Yes. Okay. Huh. It kind of makes me wonder if these kitties end up with like hyperthyroidism or something because of the adrenals being shot.
Yeah. So endocrine stuff can be part of the problem. I mean, you could have multiple things going on. Any kind of medical stress is stress, and it's gonna affect other things that are stress related. So yes, you could have multiple problems going on just from medical stress.
Yes. Yes.
So like a diabetic cat that's on kibble food, then you can get the secondary idiopathic cystitis because they've just got inflammation all over their body from the diabetes.
Ah, okay. So it can be a secondary thing because of poor diet and then, okay.
Medical stress. So any kind of chronic medical condition will stress the body. Yes. So yeah, so that's another thing you need to look at. So does your cat have other stuff going on that hasn't been addressed or hasn't been managed and is still out of control? That's something you have to do something about.
Yes. Okay. Okay. Man, the domino
Cats are
effect.
Complicated. That's why I do telemedicine consults, because every cat is different.
Yes. Yes.
At drdragos.com. And We can figure
I,
out all the underlying causes and all the things that led to the problem and then try to unravel it.
yes. Yes, and I was going to ask, what are good resources for people to get help? And you are one of them.
Yes.
And I will include a link to your website in the description of this video.
Thank you.
Yes, well, thank you for doing what you do because it's just so sad to think, like people don't get a cat thinking, oh, can I be a caregiver for the rest of my life? Like I mean, yes, you're a caregiver in the sense that you're feeding them and cleaning their litter box and whatnot, but not to the point where you're having to manage a disease every day, day in and day out.
Right.
And people like you help alleviate that and
Mhm.
go back to why they got a cat in the first place.
Yeah. So we need to try to prevent all these problems. And prevention starts with a good foundation of health. So the good diet, clean water, exercise, emotional, relationships, all that. It goes back to the foundations of health to prevent all this stuff
Yes.
can happen.
What about the reader that asked me to do this topic with you, she has her cat on a multitude of supplements. I'm not how do you cysties? Is that how you say that? Like cystitis, but cysties? Have you
Oh,
heard of that?
no, it's probably an herbal thing. I mean, there are a lot of herbal products out there, and some of them are real good. Like Animal Essentials has a tinkle tonic.
Yes, yes, that's so
and
cute.
and Now brand has a cystitis chewable, little treat thing, the urinary support chewables. So there are some nice remedies out there, but you have to be careful. You can't just throw a bunch of remedies at them and confuse the body. You have to do that with intention. And also, it's multimodal. So not only do you use the supplements, in order for the supplements to work, they have to be on a fresh food diet. And that's one mistake I saw so conventional medicine did a research on herbs. So they use sanrentang, which is one we use for hyperesthesia, but they actually use that for the idiopathic cystitis. They did research on these herbs, and they're like, yeah, they don't work. They didn't decrease all these markers. Well, they didn't change the diet. They just kibble fed these cats, right? And then said, oh, the herbs don't work. Well, the herbs don't work very well if they're on kibble food because the inflammation is just pouring out of their body all the time from the food. And the herbs are like just these little things thrown in there trying to put out the fire.
Yes.
So, had they done the study on fresh food fed cats, they would have had a different outcome because that's what we find. For the herbs and the supplements to work, you have to have that foundation of good food.
Yes. Yes. Makes sense.
Yeah.
Well, she did mention that there are a couple of Facebook groups that are good for learning more about it, which I guess are Feline Idiopathic Cystitis and then Feline Lower Urinary Tract Group. From my experience with Charlie and hyperesthesia, I think it's really important to have like a detailed battle plan from someone that knows what they're doing. Mm-hmm. And you just reinforce that by saying, you don't want to throw all this because you don't know what's working, or maybe that's not the problem. Maybe we're not addressing a root cause that is a problem.
Yeah. And then one of the common problems I see is using multiple supplements, and one will have uva ursi in it, which is anti-inflammatory for the bladder, and then saw palmetto, which is antispasmodic for the urethra and the bladder. But those, when you use them together, they neutralize each other. So nothing happens.
Yes. Yes.
So I go back and I'll look at all the supplements people are giving, and I'll find things like that. Like you're giving these two supplements and they are a wash because they're not helping, because you can't give them together. And the really interesting thing about herbal medicine is we have inflammation in the bladder. We know it's caused by stress and nerves that are more sensitive to pain and the adrenal fatigue and all that. Um, but in Chinese medicine, there's like a half a dozen or more different patterns that we see, and we treat all those patterns very differently. So we have to figure out what pattern of disharmony the cat has that has led to this problem, and that will determine the herbal formulas that they need. So,
Okay.
like commonly, you've got damp heat. Dampness is inflammation, heat is inflammation. Dampness can also be crystals.
Mm.
Um, so a lot of these guys have damp heat, and you can use the Sanren Tong or the sea mouse on, which are great for damp heat. But you can also have the emotional stuff, which is heart. Heart is the emotion. So we have anxiety, which is heart fire. So we have heat in the heart.
Mm.
And that's the primary problem. And what that does is the body has to try to get that heat controlled. So the heart and the small intestine have a relationship, a yin yang relationship. And so the heart transmits the heat to the small intestine, which then filters things out, and all the wastes go into the bladder. And that's how the bladder gets hot, from the heart fire. And
Oh.
that requires a different herbal formula. Or you've got blood deficiency, where you're deficient in blood, which causes a pet to be more sensitive to stress. Or you've got liver qi stagnation, which is also a stress-related issue, where they're just kind of irritable and grumpy. So you've got all these different things and combinations of things,
Yeah.
and that will determine which formulas work for your cat. So it's kind of complicated. That's why you need an herbalist to help you with a lot of these formulas.
Yes. And that's just the guidance. I would imagine, as I was with feline hyperesthesia, that you're just exhausted
Mhm.
by the time that you're looking for like a holistic solution, unless you
Yeah.
know someone like you. So yeah, the guidance is always very, very well worth it, in my
Yeah.
opinion.
Yeah. Otherwise, it's like trial and error. You try this formula and it makes it worse, which tells you something. So
Yes.
you need the opposite thing. But people, I think the important thing is just trying a few things at a time, and not like throwing all these things at them at the same time, because you'll never know what's going on.
Yes. Yes. Hmm. Hmm.
But that's the way we can cure it. Whereas
Yes.
conventionally, if you just do the kibble foods and give them pain medication and anti-inflammatories and, reduce their stress, which is part of it, you can't get a cure if you're doing it that way. But when you're rebalancing the body and getting the emotions and the physical body back in balance, this goes away. It just
Yes.
takes a lot of detective work.
That's good to know, and reassuring too, because I really like, over these 3 years that I've been going through all of this, like, education about restoring health synergistically in the body. That's my understanding, is it can be cured.
Mhm.
It's not going to be a quick fix, but you can
Right.
restore health.
Yep.
Yeah.
And you have to address all the components, the environment, the physical, the emotional, everything. It's multimodal.
Yes. Okay. Well, thank you. I don't have additional questions about this. Do you have anything else that I forgot to ask or you want to mention?
Some of the other stuff that I had thought about that helps with cats with stress, that's easy to do, are like your flower essences, like your homeopathic products and your flower essences. Those are a lot easier, especially with these cats that are hard to medicate. So you have to think about other stuff if you can't give them something orally. And the dried herbs that they can roll around in, they can actually get benefits from that. So there are things that you can do in like the essential oils without having to give it orally. Um, and then some of the products, like a lot of times I'll do a concentrated powder for the herb, and you just do a pinch and you like smear it on the gums for a cat.
Mm.
Or like CBD drops, you could just drop it on the paw, one drop on each paw, and they groom it off. Like you have to figure out how to make this easy and not stress your cat, because if you stress your cat giving the medication or herbs, that's
Yes.
just more stress, right?
Yes, yes.
So you really have to think about this and think about the stress that you're causing by giving this stuff. So
yeah, don't add fuel to the fire.
yeah.
So when you talk about flower essences, you mean diffusing them? Is that what you mean?
No, there are flower, like you can add them to the water.
Oh, okay. I gotcha. And brands of flower essences, Bach and Green Hope Farms, or
I think there's one called Botanical Animal Flower
Botanical
Essences.
Animal.
They have like
Okay.
a mellow out and a chill out. So those are nice.
Okay.
And they're easy to give.
Yes. And then the dried herb gardens, I know that there are folks that sell those sort of things, but I've also learned that you can just buy like organic chamomile tea, open up the bag and sprinkle it down.
Yeah, you absolutely could, because that's probably one of the ingredients in those calming ones is chamomile.
Yes.
Absolutely.
Okay. And just a pro tip here, don't put it directly on your carpet, like put down a piece of paper or something on top of it.
Usually a towel.
Yes.
Like a towel or a blanket, because cats would prefer something soft.
Yes, and they like to return to it too, so it's nice to be able to pick it up while vacuuming and then put it back down if they want to return to it.
Yeah.
Okay.
Oh, one of the interesting things about stressing your cat out is some of these cats will urinate like on your stuff, your clothes, your purse, your bed, and you. And it's like they're telling you that you're stressing them out, but they're just trying to tell you that they need help. And what commonly will happen is like your boyfriend moves in and they're kind of freaked out about that, so they're marking you.
Yes.
So it's not
Yes.
like they hate you, they love you. So it's not a hate thing, it's a love thing when they pee on your stuff. But you need to do something about that.
Yes, yes, it's a heads up. Kind of reminds me of when a cat brings an owner a mouse. It's
Yeah, it's a present.
yes, it doesn't feel like it, but and when they pee on your clothes, it doesn't feel like they love you. But yes, understanding cat behavior that also helps.
Yeah. So if it was like a situation where the new boyfriend moving in stressed the cat out and she's peeing on your stuff, then you need to help the cat get used to the boyfriend, right? So the boyfriend
Yes.
has to start feeding and giving treats and making things comfortable for the cat, so the cat will then relax and not have to be all freaked out about things. So,
Yes.
so there are you identify the problem, and then there are ways to unravel it and help the cat adjust.
Yes. Okay. Great. Anything else?
I think that's it.
Okay.
There's probably more in my brain somewhere.
I know. Well, yes, and I told Dr. Dragos this time that I just kind of wanted to go with the flow. I had asked the reader that requested this for a series of questions, and I think we nailed all of those. But I also wanted to understand or just be able to flow, because I don't have experience with this, so I wanted to learn as well. I guess she did say something about diet and stimulation playtime in the book. To me, cat wand toys are an awesome thing for playtime.
Absolutely.
They're easy. Yeah, you can do it while you're watching TV or a movie or whatever, and the cat still has fun.
Yep. Yep. You need to keep them busy
Yes.
because movement decreases stress. So you need to keep them moving, keep them thinking. Yes.
Yes. I also like a lot of those like electronic toys, where you just sit it in the middle of the room. There's one that's
And it
it
spins
used to be
around.
called the undercover mouse.
Yeah.
Yes. Um, because and what I did with my cats is I would, take it out for a couple of weeks and then put it away for a couple of weeks. So it was always like new again, but varying up that stimulation too, because I mean, I get bored doing the same thing and your cat would
Right.
too. Yeah.
Right. Yeah. Yeah. Definitely rotating toys or find one that they enjoy more and just kind of have to roll with it with your kitty cat.
Yes. Okay, so what you do so I've already got a regular vet, and I've listened to this interview and I think, okay, what does she do? What does she do that's different and how does it work? Do I have to stop going to my regular vet? Can you?
Not at all. You always will need a regular vet to get the urinalysis done, to get the ultrasound, x-rays, get a physical exam because I'm just telemedicine, telehealth. So I can't physically examine your pet to make sure that's the problem. So I rely on you going to your vet and getting a diagnosis, and then I can address it a little differently than a conventional veterinarian would do. But you still need a conventional vet for um, emergencies, lab work, testing, physical exam. Absolutely.
Okay. And then how does your process work?
So with my telehealth consultations, I have you send me all your cat's records, and I have you fill out an intake form that are different questions than your vet would ask you, your regular vet. So things about behavior and emotions and preferences and temperatures they like and that kind of thing. So I ask you more detailed history questions, and I have you send me a picture of your cat, and if you can, a picture of the tongue, either a video or a picture of the tongue, because I do tongue diagnosis, which tells me if your cat is hot or cold or yin deficient or yang deficient or qi deficient. It tells me a lot about what's going on with the Chinese pattern diagnosis. It helps me with that. So records, pictures, and intake forms. And then I go through everything with a fine tooth comb and I figure out conventionally what's going on. So I take the conventional diagnosis and make sure that's what it is and make sure there isn't something that was missed or maybe there's something else going on that I'm like, hey, I think you should do this test too, because I think we might have missed something. So I look at the conventional stuff because I'm a conventional vet too, but I focus on holistic now. So I can consult with you on the conventional stuff and make recommendations, and you would go back to your regular vet and get those, whatever I recommend. And then I figure out holistically what's going on. So the pattern diagnosis, the Chinese pattern diagnosis, and then what we need to do to fix it. And so
Okay.
I'll give you specific diet changes, whether it's a type of protein that we would change because of the energetics, and then specific herbs and supplements and nutraceuticals. And I usually try to only use a few things because I want to have those things have the best chance of working without being interfered with a bunch of other stuff.
Okay.
So I do specific recommendations, give you links to everything. And then we Zoom for an hour and talk because I send you this long email with all my recommendations and you get to look at it first. And then we'll Zoom for an hour and go through everything. And I answer all your questions. And then we talk about, what's the best way we can give this medication, because medications come in all different forms. And I tailor everything specifically to you and your pet, you and your cat. Yeah.
Okay.
So it's pretty detailed.
That is, yes. And I think that helps people know like what to expect, what do you do and why. But while you were talking, And you mentioned the different protein. I actually wondered in Chinese medicine, do these guys usually need to be on a neutral or cold protein diet?
Usually, some of them don't.
Okay.
So there are a few cases that don't with the cold damp guys. But normally the inflammation is a hot condition. So yes, cooling and neutral proteins. So your beef, pork, you could
Is duck
do
one?
duck, rabbit.
Yeah. A turkey. Turkey's
Yeah.
neutral. Is that right?
Turkeys, it depends on what chart you look at. It can be neutral or warming. And I will cheat with warming. I just won't go with hot. I won't go venison and lamb because those are hot. So
And chicken? Chicken hot?
chicken I call warming.
Okay.
But if you use chicken, I would make sure it's organic because you have that thing with if the chickens are eating GMO grain,
Oh,
then you have
yes.
inflammation in the chicken, and it's not the chicken that's causing the inflammation, it's what the chicken ate. And then
Yes. Yes. That can happen with pork too.
yeah. Mm-hmm.
Yeah. Okay. Before we started this interview, I said I wanted to start a new trend, and that was to ask people I'm interviewing what is a pet product you can't live without, and
So
what's yours?
the product I cannot live without is a fresh food diet. And I like Dr. Judy Morgan's All Provide because she has cat and dog food, and she has raw and cooked. So the foundation of health is a fresh food diet. And cats are hard to switch. And it takes a while, but it's worth it to try to just get them used to something new like the fresh food and take care of that foundation of health because everything else kind of falls into place once you do that.
Yes. Yes. Thank you for being here again.
You're welcome.
Like I said, I'll include a link I'll include the All Provide link, but also to your website, drpameladragos.com.
Perfect.
Yes.
Thank you, Jenny.
Thank you. Bye.
All right. Talk to you later.